Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. This week's podcast is an especially important one because this week we're talking about multiple sclerosis and depression with my guest, Dr. Amy Sullivan, Director of Behavioral Medicine, Research, and Training at the Mellon Center for Multiple Sclerosis at the Cleveland Clinic. We're all too familiar with how MS can profoundly affect your physical health, but it can also take a serious toll on your mental health. People living with MS often have to deal with depression, stress, anxiety, and these symptoms can become as debilitating as any others. Now, the good news here is that they can be managed, and Dr. Sullivan will be joining us shortly so that we can get into all of that. But first, we also learned a few other things this past week. Last week, the European Medicines Agency's Committee for Medicinal Products for Human Use recommended approval of Ocrevus for adults with relapsing remitting MS and primary progressive MS. Now the committee's opinion will go to the European Commission for a final decision on whether to grant marketing authorization for Ocrevus throughout the European Union. And once that authorization is given, each member country in the EU will determine price and reimbursement details based upon their own particular healthcare system. In the United States, the FDA approved Ocrevus this past March, and it's estimated that the drug is already on track to gain almost $1 billion in sales this year alone. Since Ocrevus is currently the only approved drug therapy for progressive MS, this is all really good news. Results of a study done at Harvard's Brigham and Women's Hospital could mean some very good news for the estimated 8,000 to 10,000 children who are living with pediatric MS. Currently, there's no FDA-approved treatment that's specific for pediatric MS, but a recent trial at Brigham and Women's Hospital has demonstrated that Gilenya, an approved MS treatment that reduces adult MS relapses by 67%, seems to do an even better job in reducing MS relapse rates among children. The study showed that over a 2-year period, Gilenya reduced MS relapse rates by 82% among children between the ages of 10 and 18, and that's a substantial improvement over the 38% reduction in relapse rates that were achieved through interferon injections. And I imagine that any child would prefer taking their medication in pill form rather than by injection, so that sounds like it could be good news for pediatric MS patients. A national study funded by Teva Pharmaceuticals indicates that American women who are diagnosed with MS don't feel very comfortable talking with their doctors about how their diagnosis might impact their work, their family planning, or even their personal relationships. And I think this is particularly interesting because just a couple of weeks ago at ECTRIMS, which is the largest MS research conference in the world, the results of a study of European women indicated that these very same questions about family planning and work-related questions and personal relationship issues were things that women living with MS in Europe felt were absolutely important issues. And the fact that American women aren't talking about them with their doctors just creates more unpredictability around a disease that's already unpredictable and how it's going to run its course. So while it may not be easy, it's probably worth having that conversation with your neurologist or primary care physician. For many of these questions, there's really no need to wonder because some of the answers are already out there. Speaking of the things that people living with MS don't talk about with their doctors, depression is either close to or at the very top of that list. And that's particularly troubling because experts estimate that depression affects about 50% of the people diagnosed with MS. And left unchecked, depression can take your vibrant, colorful world and redraw it in somber shades of gray. So in a moment, we're going to have a really important conversation about depression and MS with my guest, Dr. Amy Sullivan. My guest today is psychologist Dr. Amy Sullivan, Director of Behavioral Medicine Research and Training at the Mellon Center for Multiple Sclerosis at the Cleveland Clinic. And we're talking about MS and depression. So welcome to the podcast, Dr. Sullivan. Thanks for joining us today.
Oh, I'm thrilled to be here. Thank you so much for inviting me.
Well, I think it's a pretty important topic. I've read that upwards of 50% of the people diagnosed with MS will deal with depression at some point, and that compares with only about 20% of the general population who will deal with depression in their lifetime. So what's the connection between MS and depression? What makes it so much more likely that someone living with MS is going to also deal with depression?
That's a great question. And first I have to say, this is really important information that you're getting out there today. And so, I really appreciate the fact that we're doing a podcast on this, because this is one of the most undertreated symptoms of MS that I see. So I want to start by just giving you a little bit of information. As you know, MS is a very unpredictable disease, and we see varying levels of disability and progression. And so I think that the unpredictable nature of this disease can really wreak havoc on one's mental health. So that would be one of the main reasons that we would see depression. And of course, there are other reasons. Some are pathophysiological, and then some can be related to some of the drugs that our MS patients take.
And I know that, when you talk about depression, it can be a little tricky. Anyone can have an off day. Anyone can have a bad day, and you find yourself feeling sad. How does someone know whether they're feeling just sadness that's going to dissipate in the next little bit or something more serious?
Mm-hmm. So when we think about depression, there are several signs or symptoms that one must be aware of. And like I said, one of the main symptoms of MS is depression. So I think it's important that we kind of review some of the symptoms of depression. Certainly what you've described as sadness, kind of this low-grade tearfulness or just being sad that you want to withdraw. In my population, which is important to point out, is irritability. My population, the MS population, seems to display irritability as one of their main signs of depression. We also see loss of energy, and of course that can be part of the MS disease, but it can also be part of depression. So it certainly is necessary for somebody in behavioral medicine to evaluate some of these symptoms. Feelings of worthlessness or hopelessness, loss of interest in things that one used to enjoy, either increase in sleep or decrease in sleep, change in appetite or weight is another symptom of depression, decreased sex drive, another symptom of depression, and then thoughts of suicide. So what I'm looking for when I see my patients is, is this affecting their normal everyday life? So is this interfering with things that they do on a typical basis? Is it interfering with relationships that they have with important people in their life? And is there a risk or thoughts of suicide? In these occasions, I think it's very important that somebody with mental health expertise be part of evaluating these patients.
I think you raise a really important point, and I think that what happens sometimes is someone living with MS develops symptoms of depression, they recognize it, but because they haven't dealt with it before, they don't have a mental health expert as part of their care team yet. So what steps do they take? Should they call their neurologist? Should they call their general practitioner? How do they connect with someone who can start the process of helping them out?
Yeah, I think all of those are great options. So I recognize that Mellon Center at the Cleveland Clinic has a very special model, and we have a psychologist and a behavioral medicine team right here on staff. But I've gone around the country talking to different MS centers, and most of them don't have somebody tied to their center. And so I think it's important that we bring awareness to the neurology teams of how likely it is, what the high prevalence rates are for people with MS to develop a depression, an anxiety disorder, or any other mental health condition throughout their disease trajectory. And B, not only the prevalence, but what do you do? And so I think when our patients are meeting with their neurology teams, it's important to be honest with them, to say, I'm noticing some change in my emotional behaviors, thoughts, whatever they want to call it. And it's important for the neurologist to normalize that and say, yeah, this is a common complaint of people with MS. It's also important, I think, for family members to partake in the MS patient's appointment. So if the patient is not willing to verbalize these concerns, I think the family member needs to jump in and say, these are some of the things that I'm noticing, and I'm concerned for him or her, and I want to make sure that we address these issues. So they can do this in the neurology office. They can do this in the primary care office, in the OBGYN office. It doesn't matter where they do it, whoever they feel comfortable with. I just think it needs to be addressed, and empowering our patients to recognize the signs and the symptoms, as well as the high prevalence is going to be important. And that's why I'm so thrilled that you're doing a podcast on this.
Well, I'm really glad that you just brought up patients' families speaking up. I always say that MS affects families, not just individuals. And I'm wondering, how prevalent do you think depression is among MS caregivers?
Wow, that's a great question. So the caregiver literature is newer in the MS world. I don't know if we have prevalence data, but I would say that it's probably higher than the general population as well. In my practice, we typically see, I see about 1/4 caregivers, 3/4 individual MS patients. But I think when we think about the caregiver, we have to think about the whole family dynamic. So when one is diagnosed with this disease is usually a disease that hits when a patient is young, usually when their career is starting to take off, when they're developing family and friendships, when they're having children. And so this is a very pivotal time in one's life. And again, the unpredictability of this disease doesn't just impact the patient, it impacts the entire family dynamic. So when we think about the family as a whole, it's not just the significant other or the person who is playing the caregiving role if need be. It's the entire family. So it's the children are impacted. The significant other is impacted. Maybe parents are impacted, as well as the patient itself. But I think that you bring up a great point, which is that we need to make sure that the caregiver is taken care of just as we do the patient. We can get into a topic, we can get into a whole other topic, which is caregiver burden, which is something that I'm very passionate about. But that's a whole other topic, I think, that should be addressed in making sure that the caregiver is taking care of themselves so that they can, in turn, take care of anyone around them.
Well, I couldn't agree with you more. You're talking to somebody who functioned for a long, long time as a caregiver. And I understand a lot of the complexities of that role when it comes to the way I've always looked at it is the disposition of the caregiver really is going to impact the disposition of the person with MS, the person they're caring for. They're the ones who are going to bring their attitude, their outlook into the room, so to speak. And if they're having a rough time, that just creates more difficulty for everybody, I think.
Yeah, so. I agree. What I see in that role too is a lot of role reversal. So you find, so this can cause a lot of anxiety or a lot of disappointment or irritability, whatever the emotion is that one names. Because when you're looking at this population, you see, a stay-at-home mom, let's say, having to transition into a work role, or somebody who was the primary breadwinner now transitioning into the home role, or a child who is having to transition into being a caregiver or a nurse or some way of taking care of their mother or father. And so when you see these role reversals are things that people don't predict. They don't assume that this is going to happen to them, and so their life takes on a different path, and they take on a role that wasn't something that was planned. And certainly that adjustment can cause significant emotional reaction.
When you discuss depression, a word that pops up often is resilience. But an awful lot of what's been written about resilience tends to talk about it from the perspective of someone recovering from a specific traumatic event, maybe the loss of a loved one or some other significant life trauma. But MS isn't quite like that. Because it's unpredictable and because it's progressive, multiple sclerosis kind of presents you with chronic trauma, as opposed to that one-off event that eventually does begin to shrink in the rearview mirror of life. So doesn't that make building resilience more challenging for people living with MS?
Oh, absolutely. I think that's a really important point. When I think about resiliency, I think about my patients. So I've worked in some other populations, but I've been in the MS population now for the past 7.5 years. And I will say this to anybody, my MS patients are by far the most resilient population that I have ever worked with. These are people who have faced and are facing some adversity. They're facing significant uncertainty to an incurable condition, but yet they come into the office and they want to work on how do you manage my emotional reaction, and how do I make sure that MS that steals so much from me in so many other areas doesn't take my joy at the same time. And so it's so important for me to see the work of my patients because I gain resilience from them. I feel like if we all just took a sampling of all of the MS patients that we knew and looked at what they go through on a daily basis, I think to myself, wow, I am going to try to mirror one of the skills that I know one of my patients is practicing on a daily basis. So I think you're so right. This is such a resilient population that I'm thrilled to have a part in touching their lives.
What are some of the steps that you might recommend to someone listening to this who wants to work on developing a higher level of resilience? What can they do to build resilience?
Oh, I think there's a lot of steps. One thing is it's not a one-size-fits-all model, and so I think evaluating somebody and helping them come up with their own personal, individualized treatment plan is always an important thing. But I think it's also important to be flexible. So knowing that, this is not the life that I chose, but this is the life that I have. And so how do I make the most out of the situation that's in front of me? And that's a really important task that we can practice in therapy. One of the most important things I think is to develop, if you don't have it, but if you do have relationships, to make sure that you're building them. And so we think about this not only for the patient, but as you mentioned earlier, the caregiver. Developing relationships outside of just your family dynamic, I think, is so important. Relationships make us who we are. They help us to develop our value system. I think relationship building is one of the most important steps that one can take. I think another role that's important, again, not only for the MS patient, but the caregiver, is taking good care of yourself, both mentally, physically, and spiritually, if one has a spiritual approach that they like to take. So oftentimes we see caregivers even our patients, even ourselves, myself in a caregiving role as a clinician, I oftentimes put everybody else in front of me, and I don't take time to take care of myself. And when I do that, I find that I'm not as good as of a caregiver to my own patients or to my own family at home. Very similar to how my patients are. We have to learn how to, as the airline stewardess analogy, I think she says it the best when you're getting on a flight and she's going over the emergency procedures, and she says in the event of an emergency, if the cabin loses pressure and the oxygen mask drop, it's important to put on our oxygen mask first before you put on the oxygen mask of anyone around you. And basically that says making sure that we take care of ourselves before we take care of anyone else around us.
Well, I can't thank you enough for taking time today to talk with us. I mean, I totally agree that this is such an important subject. As you said, it's so often undertreated, and beyond that, I think that if people don't get a handle on it, it can really color someone's quality of life in a pretty dramatic way. So I think it's a subject we're going to be coming back to because it is so important. So I want to thank you again for all that you do to raise awareness, let people know that they can take these steps to build resilience and manage depression rather than simply allow it to take over their life and become a victim of it. I really hope we have a chance to connect again.
Oh, thank you so much. And I just want to leave with a couple of things. And one is, making sure that we normalize these issues. These are things that we need to make sure that people are aware of and not stigmatize it. The other is, like I said earlier, in this disease that I treat and that many people live, MS takes so much from an individual. Don't let it steal your joy. And, I think finally, do the research. Twitter is a great place to get some research. Your podcast is a great place to get some research. But let's make sure that we're talking about depression and anxiety and the mental health issues as well as the physical symptoms.
I couldn't agree with you more. Dr. Amy Sullivan, thank you so much.
Thank you so much.
Well, I think that's going to wrap up what I'll call Chapter 1 in our ongoing conversation about depression and multiple sclerosis. As I think you can probably tell, this is an important topic for me because I've had a front row seat in witnessing how depression can impact MS and how it absolutely multiplies the stress and anxiety anyone dealing with MS is probably already under. So it's an important topic. I think it's worth talking about. And by the way, if you have a topic that you think is worth talking about, let me know. Just go to our website at www.realtalkms.com. Go to our Contact Us page and let me know what you'd like to see us explore in one of our upcoming podcast episodes. My name is John Strum. Thanks for listening, and we'll catch you next time.